Good afternoon, everyone. We will be talking about meaningful use for health information technology, especially for providers and doctors. Um, my team, Preli Cummings, Letitia Henderson, Tanisha Jefferson. What is meaningful use? It is the measurable benchmarks providers must meet to qualify for the incentive payments. There are 4 regulations that have been released, 2 of which define the meaningful use. Objectives that providers must meet to qualify for the bonus payments, and 2 of which identify the technical capabilities required for certified EHR technology. These are incentive program for electronic health records, which was issued by CMS. These final rules define the minimum requirements that providers must meet through their use of certified EHR technology in order to qualify for the payments for stages 1 and 2 of meaningful use. And the other one is the standards and certification criteria for electronic health records, which was issued by the ONC, Office of the National Coordinator for Health Information Technology. These rules identify the standards and certification criteria for the certification of EHR technology, so eligible professionals and hospitals may be assured that the systems they adapt are capable of performing the required functions. There are also benefits of meaningful use, which includes complete and accurate information. With electronic health records, providers have the information they need to provide the best possible care. They will know more about their patients and their health history before they walk into the examination room. Next one is better access to information. Electronic health records facilitate greater access to the information providers need to diagnose health problems earlier and improve the health outcomes of their patients. EHR also allow information to be shared more easily among doctors' offices, hospitals, and across health systems, leading to better coordination of care. Lastly, patient empowerment. Electronic health records will help empower patients to take a more active role in their health and in the health of their families. Patients can receive electronic copies of their medical records and share their health information securely over the internet with their families. There are goals or objectives of meaningful use. The goal of meaningful use is to promote the spread of electronic health records to improve health care in the United States. These are increasing care coordination and fostering better doctor-patient communication, reducing medical errors, and improving patient safety such as e-prescribing, supporting delivery of evidence-based care, reducing disparities by recording demographic information, improving quality of care while fostering more cost-effective delivery, advancing payment reform by supplying needed data on provider performance, providing patients with their own portable health information.
In the high-tech legislation, Congress provided a broad framework of what meaningful use will encompass, leaving the details to be worked out through the regulatory process. Congress provided 3 general requirements for providers to be considered meaningful users of EHRs. 1. Use EHR certified technology in a meaningful manner, including e-scribing. 2. Demonstrate capability of exchanging electronic health information to improve quality. 3. Submit information on a clinical quality measures. For federal investment in meaningful use to be a success, it must recognize the wide range of capabilities of different providers when it comes to implementing EHRs. CMS plan accordingly provides a phased approach to meaningful use that consists of 3 stages over 2011 to 2015, with each stage reflecting increasing expectations and rigor. The stage approach acknowledged the need of health IT infrastructure to mature to support increasingly ambitious goals. The three stages are Stage 1, 2011 through 2012, centers on health information collection and using it to track key clinical conditions, communicate about care needs, including provider-provider and provider-patient communication, facilitate disease and medication management, and report key quality and public health information. Stage 2, 2014, focuses on exchanging and using information to improve the care of individual patients. Stage 3, 2016, concentrates on promoting systematic improvements through promoting improvements in quality, safety, and efficiency, advancing decision with support for national high priority conditions, providing patient access to self-management tools, facilitating access to comprehensive patient data, and improving population health. In order to achieve meaningful use, eligible providers and hospitals must adopt certified EHR technology and use it to achieve specific objectives. This meaningful use objective and measures will evolve in three stages over the next 5 years. Meaningful use criteria focus on electronically capturing health information in a standardized format, using the information to track key clinical conditions, communicating that information for care coordination processes, initiating the reporting of clinical quality measures and public health information, using information to engage patients and their families in their care. Stage 2, 2014, advanced clinical processes, more rigorous health information exchange, HIE, increased requirements for e-scribing and incorporating lab results, electronic transmission of patient care summaries across multiple settings, more patient-controlled data. Stage 3, 2016, improved outcomes, improving quality, safety, and efficiency, leading to improved health outcomes, decision support for national high-priority conditions, patient access to self-management tools, access to comprehensive patient data through patient-centered HIE, improving population health.
Criteria for measures of provider use of health IT functionality. Electronic health records can include a number of functions to improve the safety and quality of care, and the meaningful use criteria are met to assess whether the providers are making use of the most important features. Capturing patient health information. Using computerized physician order entry systems, which includes provider use of computer assistance to directly enter medical records. Maintaining an up-to-date problem list of patients, current and active diagnosis. Recording demographic information, preferred language, insurance type, gender, race, ethnicity, date of birth, death, and cause of death in the event of mortality. Recording vital signs, which includes blood pressure and BMI, and plotting growth charts for children, capturing smoke status, incorporating data on clinical lab results, using EHR rules for provider decision-making, patients' reminders, and insurance activities, enabling drug-to-drug, drug-to-allergy, drug-to-formulary safety checks, generating at least one report listing patients with a specific condition, spending prevention and follow-up reminders to patients, implementing 5 clinical decision support rules, checking insurance eligibility electronically and filing claims electronically, giving patients access to their health information, providing patients with an electronic copy of their health information, their discharge instructions, electronic access to their health information and clinical summaries, exchanging information and facilitating care coordination, transmitting prescriptions electronically, demonstrating capacity to electronically exchange key clinical information, demonstrating capacity to submit electronic data to immunization registries, demonstrating capacity to provide electronic submissions of reportable lab results to public health agencies, demonstrating capacity to provide electronic syndromic surveillance data to public health agencies, performing medication reconciliation at relevant encounters and transitions of care, providing a summary of care record for transitions of care and referrals, security and privacy, conducting or reviewing a security risk analysis and implementing security updates as necessary. In conclusion, achieving meaningful use during stage 1 requires meeting both core and menu objectives. All of the core objectives are required. The electronic providers and hospitals may choose which objectives or goals to meet. Though this may seem as a huge transition for health systems, it will be for the success of your organization. It is an enormous change for most people, thus it affects their jobs and their lives. Therefore, we would like to make their transition easier for both you, physicians, and your patients. This is a great opportunity for HITECH to advance without any hassle using health systems. HITECH is the future and the change will be dynamic. Thank you.
Thank you.
Thank you.